Hi, I'm Georgia Hartzog, and this is the Long COVID channel. If you didn't get to see my previous video, I'm starting this channel to help provide information to the general public, healthcare providers, basically anybody, about long COVID. I feel like there is a lot of misinformation out there, as well as just a lack of knowledge out there about what long COVID is and who all it affects. So here we are. So today I thought we'd talk about symptoms. Symptoms is one of the most important things to discuss really with long COVID because it is going to be the main driving force behind you going in to see your primary care, internal medicine doctor. You're going to have one or multiples of these things and say, oh my God, something's wrong. I need to go in. Symptoms is also one of the ways that they diagnose long COVID. They'll look at when did you have the COVID infection, how long has it been since that kind of finished, if you've actually had a resolution of those symptoms, and when these new symptoms started. They'll look at the collection of symptoms and then probably run some tests and stuff. We will get into that a little bit later in another episode. But those symptoms are going to help them decide whether or not you have long COVID. Now, I said in the previous video, there are over 200 symptoms listed. Now that is a lot. There's no way I'm going to be able to cover all 200 of those, but I will be covering the most common symptoms and some uncommon symptoms. It's also important to realize that you may only have one of these symptoms. You may have multiples of these symptoms. You know, if you know somebody else with long COVID, their symptoms may be completely different than yours. You might have one symptom that lasts for 1 week, it goes away and never comes back. It may go away for a whole year and then resurface. It's really difficult with long COVID because I feel like it's just all over the board and it's waxes and wanes and everybody's a little bit different. And I think that's what makes it really difficult for physicians and researchers trying to figure out the why and the how and all the things. And is obviously very frustrating for people with long COVID because you just don't know what to expect. So let's start with just the top 3 symptoms. Okay, so these are kind of the real biggies here. The first one is extreme fatigue. Now, we're not talking like you're just tired, you know, like you went and had like a hard workout or you didn't get a good night's sleep and you're just kind of dragging. We're talking overwhelming exhaustion. And it's not the kind of exhaustion that goes away with rest. You could get a solid 8-10 hours worth of sleep, wake up and feel just this extreme fatigue, like getting out of bed, you know, or to brush your teeth. Those things can seem monumental with this type of fatigue. And honestly, it really does limit normal activities, just normal day-to-day stuff. I mean, you know, like I said, getting out of bed, brushing your teeth, making yourself a meal. I mean, for the poor mothers out there that have long COVID and having to take care of little ones, I just don't know how you do it. And so, yes, this greatly impacts people. And I think it is actually probably one of the driving forces behind this being disabling. A lot of people cannot continue on with their normal jobs because of this fatigue. They cannot do those things anymore. I know for my husband, this is a really big one. Like I said, he'll wake up just exhausted. There's times that it is difficult for him to walk from the parking lot into, like, whether it be the grocery store or the mall. In that walk from the parking lot to the grocery store, into the grocery store, sometimes he has to stop and take a break. So it is just an overwhelming exhaustion. And I know for him, you know, he is no longer able to work. he was laid off from a job right after he had gotten long COVID, and ever since then is just not able to do a full-time position that would require him to go in. It's just not possible. There has to be times during the day that he's going to nap and rest because of this fatigue. So the next symptom is brain fog. Now this is another big one. We're talking, I mean, it's just like the name sounds, right? It feels like you've got a fog in your brain. And I feel like this word is being used by a lot of different disorders and things right now. So I feel like a lot of people say they have brain fog, and I'm not discounting. I think a lot of people do have various degrees of brain fog. Like even with menopause, there's an element of brain fog with there. But I do think with the long COVID it's a lot more severe. And so what that looks like is there's difficulty concentrating, memory problems, you can't find your words correctly, you can't think clearly. I know for my husband, this is a big one. He was used to doing a lot of writing and marketing and coming up with really good ideas and his brain being sharp. And that has changed completely. He struggles to be able to find his words on things and to remember things. And I can tell you as his spouse, it's worrisome. I mean, I've witnessed it where we'll have a conversation about something, I'll tell him something he needs to do, and then sometimes hours later, he completely forgets that. Or the next day, I'll be referencing that conversation and he doesn't remember it at all. He's only 53. And so as his partner, I mean, I'm just so worried about what this looks like long term. So yes, brain fog for long COVID is a big thing, and it can be very severe. Another big symptom is post-exertional malaise. Now, what this means is they exert themselves even just a little bit. Afterwards, the symptoms are going to come back with a vengeance. I always say, my husband, and I think we should probably give his name. His name is Todd, because I don't want to have to keep sitting there and saying my husband. So Todd, when he exerts himself in any way, we always say he's going to pay for it. There has been times we went on a trip and he wanted to keep up with us, and it was just like a lot of walking around and stuff. And even when we kind of slow down to be able to walk at his pace, when he does that for a couple of days, when we get back home, he just completely crashes and is out for like a week and just feels terrible. All of his symptoms feel a lot worse. So basically, it's a crash that happens after you've exerted yourself in some way. And all those symptoms can kind of flare up. And sometimes the exertion doesn't have to be very much at all. I mean, you could be just carrying some groceries in from the car, anything. So something that definitely to be aware of, especially if you intend to go out and do something, just know there is probably going to be a price paid for that. Okay, so those are the top 3 most common big symptoms. Now, some of the other symptoms that are also very common, okay, I'm just going to list a few, and some of these may resonate with yourself or somebody you know. Shortness of breath is a big one, or breathing problems. Todd often deals with this. Sometimes he's not even doing anything. He can be sitting on the couch and he feels short of breath. And we will address some of the causes of that in future videos, because there is something happening in the body that's kind of causing that, obviously, but we'll talk about the why. Heart palpitations is another big one, along with kind of heart racing. Todd experiences both of these things. That was kind of one of his beginning symptoms, was he was just having these heart rates that were 130s to 150s, even when he wasn't doing any activity. And he often has the palpitations, or PVCs as they're called. He can feel that just thump, thump in his chest, and actually drives him crazy. He does take a medication that does help with that. And I do recommend that for people. If you're having that sensation, it is worth going and following up with the cardiologist and getting on some medication to help manage your heart rate and, irregular beat palpitations. If nothing else, just comfort-wise, it does make a difference. Chest pain, that can kind of go along with the other two that we just mentioned. But yes, there can be the sensation, of chest pain. Dizziness, that's another big one. This kind of goes along with POTS. A lot of people with long COVID have POTS symptoms, which is postural orthostatic tachycardia syndrome. That is where if you go from sitting to standing, or if you're going from laying down to standing, if your heart rate jumps more than 30 beats per minute from those, like if you were, let's say, 55 and you stand up and it goes to 105, then you might experience the symptoms of POTS. You basically, blood is not going up to your brain fast enough. And so you experience this feeling of dizziness, or like you're going to pass out. Some people actually do pass out from that. So that can be a big, indicator of long COVID, or symptom of it. A lot of people do have the loss of smell and taste. Now that one can be a little hard because some people lost that with COVID and they just maybe never got it back. That being said, though, you can experience that just as a symptom of long COVID, and it can be a loss of taste, and sometimes it can be a change of taste or smell. Things they may smell rancid or terrible. So just know that that's a possibility also. Some people may have a chronic cough that just doesn't go away. Also, there's sleep issues, sometimes sleeping too much, not sleeping enough. I feel like sometimes the having insomnia, it can just be straight up insomnia, but I also think a lot of the insomnia is related to a lot of the other symptoms that just make it really uncomfortable to try to get to sleep. GI issues is another big one. Nausea, diarrhea, just upset stomach, abdominal pain, things like that. Headaches is another big one that a lot of people experience. Joint and muscle pain, and depression and anxiety. I'm just going to tell you right now, I don't know if long COVID itself causes depression and anxiety. I do think there's probably a role in there because it's inflammation. And there's been studies that have shown that a lot of depression is related to inflammation in the brain. But I know that having long COVID is depressing. It can cause depression. It is so difficult every single day to wake up feeling so terrible, and because it is isolating and it feels like people don't believe you, and there are this gaslighting and that occurs amongst your peers and healthcare professionals and all these things, that I don't know how anybody doesn't have depression and anxiety with long COVID. So I do think that is probably coming from multiple areas. I'm also going to talk about a couple of the lesser known symptoms, at least just briefly, because they're not very well known doesn't mean that they're not occurring for a lot of people. One of those is hair loss. I know that can be particularly devastating for people, and sometimes that can happen really suddenly. Sometimes it can happen over a period of months, but the hair loss can be very real, and can also kind of come and go. Another one is what they call COVID tongue, where there's a buildup of white or yellow fuzz on the tongue, and you can get bumps and ulcers and sore lips, which can be very painful. skin rashes, and that can look all different sorts of ways. Sometimes it can look like hives, sometimes it looks like pox, sometimes it can be longer lasting, and sometimes it can just go away. There's also a thing called COVID toes, where there's like purple blisters on your fingers and toes. There can also be this thing where it feels like, they call it internal tremors, which is just like it sounds, where people feel like they're having like this vibration inside their body. And another one is temperature regulation issues. Todd he struggles with this a lot too. And it can just be your body doesn't know how to regulate your temperature properly. And so sometimes it feels really cold, sometimes it feels really hot. The house will be, I don't know, 74 degrees, and he thinks that it's super cold, and he's all bundled up. And then at night, he'll think it's really hot, and he has these terrible night sweats. And another big, I think this is big, but that's mostly because this tends to be Todd's, one of his biggest issues and struggles, which is neuropathy. Peripheral neuropathy, as it's called, or nerve tingling. And that usually is in the extremities, like fingers, toes, legs. It can feel like a burning sensation, kind of numbness sensation for some people. He says it kind of feels like you hit your funny bone, and that kind of sensation that it is, and it can just be constant, unrelenting. And it can actually be very painful at times. For him, he can get it into his jaw. Sometimes it spreads across his chest. But I think the hard part is like I said, it can just be non-stop. And at nighttime, it will interfere with sleep a lot, because it can feel like almost like restless leg, but restless body all over, because he just feels like he has to move. And yes, definitely times where it's super, super painful. So I will tell you, for this, he does go and see a pain specialist, and I recommend that for anybody that's having issues with this. There are lots of different medications that can help treat this, and maybe I'll do just a video on that in the future. So I think I've covered probably more than I should have tried to cram into one video. But there you go. There are some of the symptoms. I would love to hear from those of you out there that have long COVID, or have it no longer do, or have friends. What symptoms are they experiencing, and have they had anything that has helped with them? All right, I will see y'all on the next one.